Good afternoon. My name is Jerry Finley. I'm the director of the EMS program here at South Plains College, and really want to talk to you today about how do we get our students from this just sitting in the classroom to really being more engaged. And the way we did that in the EMS program, and I know we're a little bit different than the general education classes, but we really try to take that student from understanding the material in the book to understanding how that applies when they get out in the world and get a job. And one of the ways we did that was we were able to purchase with a grant iPads for our students. And for my set of courses, we did 4 different plans that really integrate that technology and put it in the student's hands, so at the end of the course, they're better prepared for the real world and when they go out and get a job. So one of the ways we did that is everything in our program is really based off of their ability to critically think. And there's not a whole lot of rote memory in our program when they get to this level. It's really all about, can they take that information in, analyze it, and then deal with this person, this patient, whether it be an illness or an injury, and critically think about what they need to do in order to have a good outcome. So one of the ways we did that was the iPads. Of course, the students will have those. The iPads were able to integrate real scenarios into the lesson plan. So we're lecturing on patient assessment. So now the student has the ability to ingest that information out of the textbook, and then we put a scenario up on the screen. They're able to walk through that scenario on their iPad. And the way they do that is we in EMS have to document everything. Everything has to be written down. So the iPads allow them to take that scenario, create a plan based off their ability to critically think, take that, put it into the iPad so they have this chronological report, if you will, of what they should do for said patient. Great example is patients having chest pain. So the student takes that and says, okay, this patient's having chest pain. Based on their knowledge of the questions that they need to ask prior to starting treatment is going to guide their ability to treat. The iPad comes into play when they say, okay, I've got this chest pain patient. Now, here's what I'm going to do, and here's the expectation I have based on how I treat them. And in the EMS world, that documentation is really legally binding, and their ability to be able to take what they did, what they saw, what they heard, and put it into a written narrative is going to benefit them in the long run. Our end of course exam, which is for a national certification, really that whole exam is based off of just that, their ability to be able to critically think. And of course now everything's computer based. So when they take that credentialing exam, we are able to mirror what they're going to see in that exam. They see a scenario in the classroom off this iPad, they're going to see that same type of scenario when they take that national exam. And so the bridge that we're able to create with this technology is allowing us to have that student better prepared when they get to that credentialing exam. The next way that we tried to integrate this technology was with pharmacology. That's one of the courses that we teach in the EMS program, and the entire semester we're talking about different types of drugs. We're talking about how those drugs act in conjunction with other drugs, how they react based on the person's weight, their metabolism, all kinds of things. So we are able to take this extensive and pretty exhaustive list of drug cards and put them on that student's iPad. So now they have the ability at any given moment when they're going through this scenario, when they're trying to understand how to better critically think, they can pull up these drug cards. And these drug cards will tell them the drug name, the dosage, the actions, the interactions, why we give it, why we shouldn't give it, what we can expect when we give that drug. So this is going to be a wonderful tool for us to really essentially put the classroom in their hands. Probably the last thing I'll talk about is how we integrated the iPad and that technology into our trauma class. Our trauma class is really nothing but doing assessments and learning how to critically think with a trauma patient. Some minor, some major, but this trauma patient has this injury. And sometimes injuries, we get really tunnel visioned with that, so we have to get the students really geared towards understanding I've got to look at the big picture and I can't get focused on this one thing. So we're able to put information into the instructor's computer that will be populated on the iPad, so the entire class is seeing the same scenario at the same time, while we have students in the front of the classroom actually running through that scenario. And it really allows the students to be able to critique each other, and that's really the way we learn in EMS. We see it done, and we go, oh, wow, I could have done that a little different. And really the bottom line is these iPads and the ability of us to take what we have at our disposal and populate it on those iPads is really going to allow us to teach that student to critically think, to teach that student that there's more to the learning process than just reading it out of the textbook. There's more to the learning process than listening to me lecture for a couple of hours a day. There's this ability that now the students have this in their hand. They take it with them. They're able to pull up this valuable information, whether they're in the classroom, whether they're doing homework, whether they're at the hospital doing a clinical. It really broadens our ability to transfer what we're doing in the classroom so the students walking around with that constantly. And they don't have to have this big, thick textbook that they're running around with. We've got all that information at the students' disposal. And the students have access to that technology throughout the entirety of their time in our course. So they start getting really comfortable with using that. And that's just one small way that we in the EMS program have been able to merge what I like to call the traditional classroom and kind of pull technology into the realm of learning, with our hopes that when the student takes that credentialing exam at the end of their time with us, that they're better prepared, they're more comfortable when they sit down in front of that computer to take that computer-based exam, and that ultimately our outcomes improve. Thanks.